Welcome back to Sleep Better TV. The connection between TMJ and OSA is apparent, especially if you are a dental professional who treats sleep disorders and TMJ. My guest is one of those, Dr. Stephen Lawson, with the TMJ and Dental Sleep Therapy Center of Winnipeg. Dr. Lawson, it's a pleasure. Talk about, this is a big part of your practice. Talk about how the two relate.
Yeah, I have to liken back to a slide that my mentor, Dr. Steve Olmos, with the TMJ and Sleep Therapy Centers, does a lot of lecturing and presentations worldwide, and he's got this one slide, that shows these two caricatures, standing there with their noses joined, and like they're two different entities, but they're joined in the middle. And I get a kick out of that because it absolutely typifies what we see on a daily basis in this practice, where we do a lot of TMD, craniofacial pain treatment, and a lot of treatment for obstructive sleep apnea. I guess the reality is, I cannot treat chronic pain, TMDs, temporomandibular joint dysfunctions, neck pain and facial pain, and I cannot treat them without understanding what's going on at night. I cannot treat them without managing the airway effectively for these individuals. And the reason that's so important is, in reality, my average patient pool, probably 70% of their symptoms are a function of what's going on at night, and 30% is a function of what's going on during the day. So if I don't know what's going on at night, and I'm not aware of why is a person clenching and grinding, and if you have a dysfunctional jaw relationship in the temporomandibular joints, what could be harder on those joints and subsequent symptoms than clenching and grinding on them all night long? So we manage these patients effectively, and we manage them better because we know now what's going on at night that is precipitating the clenching and grinding. And you know what? 70% of the time, clenching and grinding is from an airway issue.
And is that because the person is struggling to breathe and then they're clenching and trying to get air? Is that kind of what it is unconsciously?
That's exactly right, yeah. That's exactly right. You develop what's called rhythmic mascatory muscle activity, and when the oxygen levels go down, or more correctly, really, the carbon dioxide levels go up, your brain becomes alerted as a part of your systems to this, and it wants to breathe. It wants for something to happen to get more air. So what do? Well, what it does is it throws your mandible forward. The masseter muscles kick in, the mascatory muscles kick in. The brain gets the muscles to get the jaw going forward to dilate the airway, and it's exactly what an oral appliance does to treat snoring or obstructive sleep apnea. We move the mandible forward in an effort to move the tongue forward so we can eliminate the obstruction. So the connection there, of course, is that the clenching and grinding is probably from an airway issue. And, even when I look at the patient intake, and the patient thinks they're coming to see me about their chronic pain, and in our patient intake forms, we have the left side, which are really all TMD symptoms, and then the right side, which are primarily airway symptoms. Well, 70% of the time, the patient's ticking things off on both sides of the page here. Now, they have no clue about, why they're clenching and grinding, and maybe snoring is there, but it's not a big deal because they're not sleeping in the same room as their wife anymore. But the fact of the matter is, by the time we do our evaluation and we sit down and actually talk with the patient and deal with these things, these patients realize, I'm here for a jaw problem or for chronic pain, but the airway is a huge part of getting better or managing the airway effectively, because quite often they do have sleep apnea, or they don't, and we get them to do a level 3 test. And on the flip side, if I'm seeing a patient for an airway issue, they have a sleep study done and they want to be treated for their obstructive sleep apnea, well, a big part of my evaluation is therefore, obviously, to see if they are a good candidate. And we have many measurable signs that we can look at to determine if this individual is a good candidate, including pharyngometry and acoustic imaging of the airway. But I need to do an evaluation of the jaw joints. I need to do a TMJ evaluation. If I think I'm going to move their jaw somewhere to open up their airway, I better know I can do it comfortably. And if the patient has some TMD issues that they're not aware of, and they often do, I need to let them know that they have these issues so that they understand that I may be required to manage some TMD discomfort while we go treating the OSA. So the two of them are so completely intermingled that I couldn't possibly practice with any level of success if I didn't know a lot about both of these entities.
It seems like in the last 30 seconds here, it's fairly common that somebody comes in, presents with chronic pain from TMJ, but if you cure the OSA or at least alleviate much of it, it takes care of the other problem.
Oh, actually, that's profound, because just this morning I had a couple of patients in here, and back to back, and one was for OSA and one was for TMD, but in both cases, and because they were men, and let me just point out that TMDs are, my patient pool and TMDs are 9-to-1 women, and there's a lot of reasons for that we won't go into now. But both of these individuals, I looked at managing the TMD for this one individual with only a night appliance, whereby I was preventing the clenching, grinding, and maximizing the airway capacity. And the other person, I was also treating with only a night appliance, even though they had TMD issues and obstructive sleep apnea. When you put the condyles forward with an airway appliance at night, when they're typically in centric occlusion going to be back, then you are positioning them at least at night in a much more favorable position. So you're treating both patients really with the same appliance in this particular case.
Fascinating. Dr. Lawson, great pleasure. Thank you so much.
Oh, it's my pleasure. You have a nice day.
Dr. Steve Lawson is with the TMJ and Dental Sleep Therapy Center in Winnipeg. He is an expert in the field, as you can tell. This is Sleep Better TV. Thanks for watching.